We're back with Dr. Tom Lewis, Chief Science Officer of Real Health 120. Dr. Tom.
Steve, how are you today?
Good, good.
Good.
I wanted to go back. We discussed earlier about the eye.
Correct.
And how you diagnose through the eye. That's one of the things you do. Tell us about the eye as far as what's out there today, the news of the eye. What are other people doing? How are they looking at the eye?
Well, there's a lot of news about the eye and its connection to Alzheimer's, and it makes an awful lot of sense because the retina, the photographic plate in the back of the eye, is really part of the brain, and you have this retinal nerve fiber layer, a very long nervous system structure that ties into the brain at the so-called visual cortex at the back of the brain. So there's a lot of components in the eye that are clearly nervous tissue that are related to the brain. So it really goes back 10 years. I don't want to say I laugh at the news today because I've seen it all before, but 10 years ago a group from Harvard, a very esteemed group, published a paper, and they did a big road trip, Today program and all that, about how so-called supranuclear or cortical cataracts, which are not the normal cataract that people think of, those are nuclear cataracts. These cortical cataracts have the exact same protein found in the senile plaques of Alzheimer's disease. A very exciting result. They built a company to do diagnostics. They've been trying to raise money. They've been fumbling around with this for 10 years. So there have actually been a lot of different components of the eye tied to neurodegenerative diseases like Alzheimer's. And the point I make is that with a disease as complicated as Alzheimer's, it's a syndrome. It attacks different campuses, different lobes of the brain, whatnot, that if you try to pin your hopes on using a diagnostic on one parameter in the eye, for example, you're going to have some successes and you're going to have some failures. So our approach is to use a multiplicity of eye components that are all tied to both the vascular and the nervous system. So, for example, you can Google glaucoma and Alzheimer's disease, and you'll find papers that say Alzheimer's is glaucoma of the brain, and glaucoma is Alzheimer's disease of the eye, because they share similar pathologies, similar inflammatory components. Macular degeneration we consider a precursor to Alzheimer's. Now the eye is more sensitive than the brain. The brain actually has more redundancy than the eye. So in a lot of patients, macular degeneration occurs before Alzheimer's, but macular degeneration patients are much more prone, statistically, if they live long enough, to develop Alzheimer's than the same person of the same age without the macular degeneration. So I laud the news about the connection between the eye and Alzheimer's disease because it's very true, starting with that paper in 2003 by a very prestigious group at Harvard, and now Harvard and BU. So they're on to the right thing.
Why hasn't it got traction? It seems like that's a logical step. I don't
understand the politics of medicine, but today, if you have a loved one or yourself, most likely if you have a loved one that you're taking care of, that seems to be having memory issues, and they go to that PCP, they're going to get referred to a neurologist.
Okay.
And the neurologist is looking at this from a brain-only perspective. They're going to take maybe an MRI to see if there's some atrophy, and they're going to be doing some basic cognitive testing, school quiz type testing to see if you can answer some fundamental questions that are designed to determine what part of the brain is most affected.
Okay.
And so-called executive function deterioration is usually ascribed to Alzheimer's disease, whereas Parkinson's or general dementia impact different parts of the brain. But our point is, it doesn't just impact the brain. It impacts the eye. Okay, the eye is part of the brain, but the eye is clearly right involved, as is the brain, in the circulatory system, the vascular system. So our thesis is, use the eye for screening. Yes, it's more sensitive. People tend to have eye issues well before they have cognitive issues.
Okay.
So this is a way to do screening, and now we're not going to just a priori treat people because they have something wrong with their eye and they might get Alzheimer's. We're going to do testing.
Okay.
We're going to do testing looking for what we consider the root causes of the disease, which is inflammation in the system and a lot of factors that can propagate the inflammation. Poor nutrition, diabetes is being linked to Alzheimer's, infection, neuroinflammation caused by infection. All these factors need to be looked at. So my take-home lesson in the eye, a really good, non-invasive, low-cost screening method to look for people susceptible to Alzheimer's and other neurodegenerative diseases. But then you have to go through what I call a deep and broad differential diagnostic process to find out what the root cause is. Now you have a treatment strategy. Whereas if you just label it Alzheimer's disease, it's a death sentence because the standard of care in medicine recognizes under the current way of looking at it and our way of looking at it, there's no way to stop or slow the progression of the disease, maybe just alleviate some symptoms. It's called palliative treatment. So we don't accept the diagnosis of Alzheimer's disease. We want to go out in a variety of different ways to find out what the real cause is.
So if you're not testing,
you're guessing.
Okay.
That's the slogan of the functional medicine. So you have to test, and it's not one test. I think that's the point. It's a multiplicity of tests to support each other like a foundation to a building.
Again, fascinating. Thank you so much.
Very good. Thank you.
Yep.